Minutes with Dr. Ralph. In this episode, we shall be discussing the menstrual cycle. All attention now is start to be focused on the female menstrual cycle as the only way of controlling fertility. While this unilateral attention may seemingly not be of any consequence in the majority of our human day-to-day reproductive lives, the unilateral bias, however, becomes implicated in cases of infertility. This is because in cases of infertility, the woman's menstrual cycle must be consciously matched with the man's menstrual cycle if pregnancy must be achieved. This may sound strange, but the total unavailability of this information may be responsible for most cases of infertility. To understand the concept of menstrual cycle is to know that sperm production does not occur at the same rate and at the same capacity in every man. While in some it is higher and faster, in some other men it is slower and of low capacity. For instance, while it may take a given man about 3 days to 4 days to replenish the sperm quantity and quality capable of impregnating a woman after an ejaculatory episode, it may take another man up to 1 week or more to achieve the same. If a given man is oblivious of this fact and goes on to ejaculate every 2 to 3 days, the sperm level will go below optimal. He consequently remains in a state of infertility, and this may appear to be responsible for most cases of infertility we have. This is even made worse when such infertile couples are advised by their doctor to have regular sexual intercourse, estimated for them at 2 to 3 times a week. Such couple, in an attempt to meet up with the doctor's prescription, often goes to have sexual intercourse every day in an attempt to meet up. This keeps such couple in a state of permanent infertility. We therefore advise that for every couple with cases of infertility, it is important to put into consideration the man's menstrual cycle. In the next episode, we shall be discussing in details the menstrual cycle of the woman, how to calculate, plus other topics that as we discover from our clinical practices. Note, however, that the information you have just heard, the menstrual cycle, is a product of this presentation and may not exist elsewhere. Therefore, calls for more intensive experimental researches for verification. Thank you, as we see you in the next episode.